Welcome to Vital Signs Podcast. My name is William Hatton. I'm the Public Affairs Officer for West Texas VA Healthcare System. We're here to do a bit of an educational podcast, trying to educate our veterans in the West Texas area about some of the different services that we offer here, but just the resources that are available to you, the veteran, or if you have a veteran in your life. These resources are very valuable. We try to put on podcasts like this so that we can help kind of make a veteran's life a little bit better with each piece of knowledge that we put out there. And so I'm so thankful I've got Dr. Carol Chakaroff here with me. She is an optometrist with our eye clinic here at the West Texas VA here in Big Spring. And so I'm appreciative of you coming in. She's going to talk to us a little bit about some of the services that are available there in the eye clinic, and I don't know, some of the things that might be important for you as a veteran or somebody in your life to think about when considering a visit to the eye clinic. So kind of tell us a little bit about yourself, what led you to the VA.
Sure. So I grew up far away from Texas. I'm from New Hampshire.
Okay.
And I originally got exposed to VA just while shadowing before I was going to optometry school, just thinking about the profession. And through there, just really enjoyed the atmosphere. I liked all the learning that goes on in the VA. I really enjoyed working with veterans. And that's how, as a student, I chose to do a VA residency and then ultimately end up here at the VA. Mm-hmm. And I ended up in Texas because my husband is from around here.
Well, so, cool.
Yeah.
So, why don't you talk to us a little bit about some of the different services that are available there up in the eye clinic?
Sure. So, our eye clinic operates full-time. And we have 2 full-time providers and then 2 fee-basis providers. So doctors who are here just 1 day a week. And we provide all your basic eye care needs. Mm-hmm. So if you are young and healthy and just need a new pair of glasses, or if you have glaucoma, or if you got something in your eye and you're in a lot of pain and we need to see you same day, flashes, floaters, whatever it is, we can take care of 95% of it up there, including cataract surgery we do here at the VA.
Okay. So if I'm a veteran at home, let's say I'm getting up there in age and I'm starting to have vision issues, what are some things that I should be thinking about in terms of my vision and considering a trip to the eye clinic?
So first, you should know that all veterans are eligible for eye care. Okay. It's not like dentistry, which I think has some more rules about who qualifies and who doesn't. So if you're eligible for VA care, you're eligible to come see us and we can check it out for you. And yeah, absolutely. Especially if you haven't had an eye exam in a long time. And I see this often. Some people who has been 10, 15 years and they haven't had their eyes looked at, come on in and let us take a peek at them. Mm-hmm. Typically, when you come in for your first eye exam with us, we will plan to dilate your eyes. And that involves putting drops in your eyes that make your pupils larger for about 4 hours. So we can get a good look inside, looking for things like cataracts or macular degeneration and glaucoma. So prepare for that. And if you have some nice sunglasses you like, you can bring those, or you get to wear our very cool paper ones on the way out.
So I think when your vision's good, you don't think about a trip to the eye exam. But I imagine there are some kind of comes with age or just in general, even as somebody is, like in my case, about to turn 40, there are probably things like a typical time frame when somebody should probably visit the eye clinic. Is that right?
Yeah. And actually about turning 40 is a pretty common time because most people start to have issues seeing up close around 40, 45. And it's especially hard when you've had, I'm sure you're like this, really good vision your whole life. And then all of a sudden you're like, I can't see my phone anymore. And you got to pull it way out here. Sure. So that's a great time to check in so we can make sure things are looking healthy. But honestly, anytime. There are things that can happen inside your eyes, like glaucoma can cause vision loss without you noticing because it affects your side vision way out here. Or another common thing sometimes is there can be like freckles or little holes in your retinal tissue that you wouldn't have symptom of, but we could probably treat or manage for you.
Okay. So as a veteran, if I just want to drop on down to the eye clinic, it's as easy as picking up the phone, right? Like I just schedule an appointment right away. I don't have to have a consult or anything like that.
Correct. Yep. So you can give us a call and speak with one of our schedulers, or if you happen to be at the VA and want to just swing by, you can speak with our scheduler right there in person.
Okay.
Yeah.
So I appreciate you coming in. You're going to show us an app, I believe, right?
Yeah.
Is that right?
So one of the other services that we haven't really talked about is we provide low vision rehabilitation and also TBI vision rehabilitation.
Okay.
And this is a device that can be used by people who have vision loss. So it can help you to see better. Mm-hmm. And there's lots of other devices that the VA can help assist you with your vision loss if you have that, but this is just one of them. And this is an app that's free and can go on any Apple device.
Okay.
And it'll read text to you.
Cool. So for those who are listening at home, she's got her iPad out and she's just scanning a piece of paper and is literally reading to her right now.
Yeah, which is pretty cool. Also could be very annoying if you're just walking around reading stuff.
Sure.
But it's very handy, and you can put it on your iPhone too, so you can connect headphones into it.
Okay. And
that way people don't need to hear what you're reading, but obviously for demonstration, read out loud. Another cool thing this app does is it has a barcode scanner. So if you're at the grocery store.
I'm not really sure what it is, or I kind of want some information about it.
Yeah, like what is this? It'll beep when you're getting close to the barcode.
Processing.
And then we'll
garlic Carolina Reaper hot sauce.
Tell you what it is.
Well, cool.
Which is cool.
Yeah, I think in what you're talking about with veterans or patients with low vision, can't really see very well, may or may not be legally blind, that can use an app like this just to help them kind of navigate the world around them.
Right. Absolutely. Yeah. And there's lots of different ways to have vision loss. And, this could be helpful with someone who actually has fairly good vision, but maybe just doesn't see well because of poor contrast or something like that. So there's lots of things that we can mess around with. And it's actually one of my favorite parts of my job because it's really creative and we get to play around with cool toys. So if anyone's struggling with those things, definitely don't be afraid to bring it up at your next appointment with us.
Well, I just think it's interesting how technology is becoming a part of healthcare in the sense of like an app like that, or I have tinnitus issues. And so, using an app on my phone to help alleviate some of that ringing in my ear, for like in this case, it's, an app that can tell you about what's going on or what's around you, if you're having struggling reading different things. Is there anything before we kind of wrap up that you feel like the veterans would be helpful for a veteran to know?
I guess a couple more things. So one is patients often ask us about glasses and if they can get glasses through the VA. And the answer is yes. If you need glasses, the VA will provide them. And if you need a change in the prescription or they need to be replaced, you can get a new pair at your eye exam the following year.
Okay.
So that's a great benefit. And then another thing I wanted to mention is we're working on getting a mobile eye clinic set up.
Okay.
Which will be pretty cool. So it'll be a big van with a full exam lane in it. And we're hoping to bring it to different C-Box and other kind of locations that are further away from Big Spring.
Sure.
To help patients come see us a little bit easier.
Well, that's awesome.
Yeah.
Well, thank you so much, Dr. Shakarov, for coming in. This has been Vital Signs Podcast. If you're listening and you've had a chance, go back and listen to some of our earlier episodes. We just had a veteran profile with Stephen Cortez. That was a really good conversation. I was able to sit down with Stephen and talk about his time in the Army. And we're going to keep doing those things, educational podcasts like this, and just trying to kind of connect with our veterans in different ways. And this is a good opportunity for us to do it. So I appreciate you coming in. Yeah. Thank you so much. This has been Vital Signs Podcast. We'll see you next time.